Now for question 12. The HCP prescribes digoxin, the toxin here. 0.25 milligrams PO for a client with AFib, atrial fibrillation. The label reads 0.125 milligrams per dose. How many tablets does the nurse administer to the client? Ooh, this one's really tricky. Okay, so let's set this up here. So first, we're identifying what we're solving for. We're solving for tablets per dose, right? So this is the formula method. So let's set it up. D over H times the quantity. So D is that desired or basically doctor's ordered dose. So D is 0.25 milligrams. H is for what you have on hand, 0.125 per tablet. Now, the D and the H are both in milligrams, so that's Gucci. Let's move on here. So the Q is the quantity. It's 1 tablet. So setting up the formula, it's going to look like this. 0.25 over 0.125 times 1 tablet. So once we do the division here, we get the answer of 2, and 2 times 1 tablet is 2 tablets per dose. So the correct answer is 2 tablets. Moving on to question 13, the unlucky number here. So the healthcare provider, the HCP, prescribes acyclovir 0.05 grams PO for a client with shingles. The dose on hand is 50 milligrams per tablet. How many tablets does the nurse administer to the client here? Okay, now this one is a little bit tricky, so let's break it down here. So the question is asking tablets per dose, right? And we're going to be using the formula method as usual. So let's set it up. D over H times Q, right? Drinks around the house times the quantity. Now here's where it gets tricky, right? D is that desired dose or the doctor's order. So 0.05 grams. Now the H, this is where it gets hard. The H is for what we have on hand. H is 50 milligrams per tablet, right? So look at that. The D and the H are in different milligrams or grams. So they're not the same. We have to convert them. So setting up a ratio to convert grams to milligrams is a necessity here. So let's set it up. So we have 1 gram over 1,000 milligrams because there's 1,000 milligrams in 1 gram. So drop the unit of measurement for everything except for X. So we're going to cross multiply to solve for X here. So 1X milligram is 0.05, basically 1,000. So our X milligram here is 50 milligrams. The new desired prescribed dose is now 50 milligrams here. Now, what is the quantity, or basically the Q? So the Q is 1 tablet. So the formula for this question should look like this. 50 over 50 times 1 tablet. So as you know, 50 divided by 50 is 1, and 1 times 1 is 1 tablet per dose. So the correct answer is 1 tablet. All right, now moving on to question 14. The healthcare provider, HCP, prescribes a pediatric client who weighs 64 pounds cough syrup, 4 milligrams per kilogram in 1 dose. Now, the medication on hand is super complicated here. 500 milligrams per 4 mLs. Ah, crap. Now, how many mLs does the nurse administer to the client? All right, so let's break this down. This question requires several steps to determine the final answer, which is mLs per dose. So first, we're going to convert the child's weight from pounds to kilograms using a ratio to solve for X here. So simply remember, 1 kilogram is 2.2. So if we have 64 pounds, we're simply dividing that by 2.2. So 64 divided by 2.2, the child's weight in kilograms is 29.09. Now, using the rules for pediatric dose calculations, the child's weight is 29 kilograms here. Next, determine the child's dose per weight in kilograms using a ratio here. So the question provides dose per weight in kilograms, which is 4 milligrams per kilogram. So all we're doing is multiplying 4 times 29 kilos, and we get 116. So when the question asks, what is the desired prescribed dose for the client, The D is 116 milligrams. Now, what medication dosage do you have on hand for the H? Well, the question states H is 500 milligrams per 4 mLs. Okay, now it gets a whole lot simpler because the D and the H are both in milligrams. So the Q, the quantity here, is 4 mLs. So your formula should look like this. 116 over 500 times 4 mLs. So 116 divided by 500 here is 0.23, and 0.23 times the Q, our 4 mLs, is the grand total of 0.92 mLs per dose. So the correct answer is 0.92 mLs. Now, moving on to question 15, the healthcare provider prescribes 10 milligrams of tramadol IV for a post-op client. The medication on hand is 100 milligrams in 10 ml vial. How many milliliters does the nurse administer to the client? All right, so let's break it down. What are we solving for? We're solving for mLs per dose, right? So we're going to set up the desired over half or formula method. So D over H times the Q. So the D here is our desired prescribed dose, and that is 10 mgs. And the H is for what we have on hand, and that is 100 milligrams in 10 mLs. So the D and the H are both in milligrams, so we are good. Let's move on to Q. Q is the quantity, right? So we have 10 milliliters. So the formula should look like this. D over H, so the D is 10, the H is 100, times the quantity is 10 mLs. So 10 over 100 is 0.1 after we divide it. And 0.1 times 10 is 1 ml per dose. So the correct answer is 1 ml per dose. All right, moving on to 16. The healthcare provider prescribes 300 milligrams of magnesium IV to a client with hypomagnesemia, that low magnesium. The medication on hand is 1 gram of magnesium in 50 ml vial. So how many mLs does the nurse administer to the client? All right, so let's break this down. We're solving for milliliters per dose, or mLs per dose. So we're setting up the formula method here. So D over H times the Q. So remember, drinks around the house times the quantity. So what is the desired prescribed dose here? Well, D is 300 milligrams, right? And the H is 1 gram in 50 mLs. All right, so hold your horses here and stop it here. So look at this. D and H are in different quantities. We have milligrams and we have grams. So they're not the same here. We have to be in the same measurement. So H is not the same as D, so we have to convert them to match each other. So before we do that, look at the quantity. The quantity is pretty simple because it's 50 mLs. So now let's convert the unit of measurement to make sure D and H match. So as you know, 1 gram is 1,000 milligrams. So now let's set up the formula. Your formula should look like this. 300 milligrams over 1,000 milligrams times 50 mLs. So first determine, or basically divide, 300 divided by 1,000, and that is 0.3. Then 0.3 times 50 mLs, we have 15 mLs per dose. So the correct answer here is 15 mLs. Now for number 17, the healthcare provider prescribes 1 gram of cefazolin, or however you say it, IV for a client diagnosed with cellulitis. All right, so the medication on hand is 250 milligrams per ml. How many mLs does the nurse administer to this client? All right, so as usual, first we're identifying what we are solving for. We're solving for mLs per dose, right? Then we're setting up our desired over half formula method. So drinks around the house times the quantity. So what is the D, the desired dose, or basically the doctor's order? So D is 1 gram. And the H is for what we have on hand. So what we have is 250 mgs in 1 milliliter. All right, so hold your horses here. H and the D must match. So the D is 1 gram and the H is in milligrams. So we have to convert those. But before we do that, let's look at the quantity. The quantity is 1 milliliter, right? So that's good. Okay, so let's convert this. So we have 1 gram is 1,000 milligrams, right? So the new desired or prescribed dose, D, is now 1,000 milligrams. So your formula question should look like this. 1,000 over 250 times 1 ml. So let's break it down. 1,000 divided by 250 is 4. And 4 times 1 ml is 4 mLs per dose. So the correct answer here is 4 mLs. Now, moving on to question 18. The healthcare provider prescribes 500 milligrams of metronidazole IV for a client diagnosed with PID. The medication on hand is 250 milligrams per 50 mLs. How many mLs does the nurse administer to the client? So first, we're identifying what we are solving for. We're solving for mLs per dose, right? So next is setting up the equation, basically the formula method. So we're calculating D over H times the Q, drinks around the house times the quantity. So the D, the desired dose, is 500 milligrams. The H is 250 milligrams in 50 mLs. Now the D and the H, they are both in milligrams, so it is good. Now the Q for the quantity is 50 mLs. So the formula should look like this. 50 over 250 times 50 mLs. So first we're doing 500 over 250. And 500 divided by 250 is simply 2. Then we take 2 times 50 mLs, and that's 100 mLs per dose. So the correct answer is 100 mLs. Now for question 19. The healthcare provider, HCP, prescribes 250 milligrams of ceftriaxone, the antibiotic, for a child with epiglottitis. The medication on hand is 25 milligrams per ml. How many mLs does the nurse administer to the client? So first, we're looking at what we are solving for. So we're solving for the quantity of mLs per dose. Next, we're setting up our equation here, the formula method. So for the calculation, D over H times the Q. So drinks around the house times the quantity. So as you know, the D is the desired prescribed dose, 250 milligrams. The H, for what we have, is 25 milligrams in 1 ml. Now the quantity here is 1 ml. So your formula should look like this. 250 over 25 times 1 ml. So simply divide 250 by 25 and we get 10. And 10 times 1 ml is 10 mLs per dose. So the correct answer is 10 mLs. Now for question 20 here. The healthcare provider prescribes 250,000 units of penicillin, IV, for a child diagnosed with pneumonia. The dose on hand is 1 million units per ml. How many mLs does the nurse administer to the client here? All right, so first we are breaking it down and identifying what we're solving for. We're solving for mLs per dose, right? So we're using the desired over half formula method. So drinks around the house times the quantity. So the D for a doctor's orders, or basically the dose prescribed, is 250,000 units over the H, which is 1 million units here. Now the quantity is 1 ml. So your formula should look like this. 250,000 here over 1 million times 1 ml. So simply divide 250,000 by 1 million, and that's 0.25. Now 0.25 times that 1 ml is 0.25 mLs per dose. So the correct answer here is 0.25 mLs.